Today I'm going to show you the new, some few new technologies and devices which will help you to monitor your blood sugar better. Particularly for type 1 diabetes, there is no need for finger prick and blood testing anymore. So what do? This is a freestyle, I call it Libre, but Libra. It's a small device. You charge it with a USB charger. Can you see? Yeah. And once it is charged, you switch it on, and as simple as that. And that will also show you the range, and it is showing my previous records, and the blue is the normal range, above is hyperglycemia, which is bad high sugar, and low is hypoglycemia, low sugar. Yeah. So this thing that I scan, there is a circular disc there, so it is like an electrode, and I'll show you a picture. So this electrode is like this. Yeah, it's a sticky thing. So. Yeah. So basically, you stick it, you take the plastic off and stick it with adhesive which is already there, electrode jelly, and there's some sort of micro teeth which you won't feel it. It's not like a needle prick or anything. It's just like a sticky tape, and it goes into your capillary blood. Somehow, I don't know how they do it, but it's very clever device. So, and that can stay, I think, for 10 days probably, or kind of 2 weeks, 10 days. It'll give you warning, and this is the box. So the device is like this. Yeah, also from the same company, Abbott. Again, I'm going to do one more. So switch it on. Yeah, and then just, and as you can see, it is giving millimole per liter, 5.8. So as you can see, I'm still within good. My readings are mostly on the lower range, and it will tell you end in 9 days. So this strip that I'm wearing will still work for another 9 days, which is pretty good. So now if I move on to the next bit of testing, which is the ketones in your blood. Now this is particularly dangerous when patients come with type 1 diabetes, diabetic ketoacidosis, you call. They're acidotic, and that's a medical emergency. And how you can measure your ketones in the blood, I wish that the company would very soon figure out a non-invasive way of measuring blood ketones. So this is a chart so that you can interpret your values. Are you in the green range or yellow range and red range? So this, unfortunately, you'll have to finger prick. And the way you do it, this is your shop's box bin, and these are depending on which color you want to choose. Like I am choosing green, so you choose your Lancet, and then this is your device. And there is some guards, like I'm going for the smallest, sorry, not smallest, the less deep, and you can increase the length of the needle pricking your skin up to 5, but I'm just doing the least. You won't even feel it. So this is the firing button, and the way you do it, you take it out. What I've done, I've taken the cap off, I slotted it in the slot, and I'm pushing it in until it clicks. It's clicked, and now I'm going to, okay, so it should come. So when you prick, don't prick here, prick on the side, and just bring the blood like this, okay, and then hold it tight, a small drop of blood. So you switch it on, okay. Apply blood. This automatically is a clever device, automatically telling it is a ketone test. Can you see? It is sucking in, and now the butterfly is flying, and my finger is bleeding, and very soon it will tell the score. So you need to get some sort of, okay, 0.1. Now is it good or bad? So 0.1 is very good, isn't it? Because anything less than 0.6 is good. So I'm okay. However, I'm doing this as a guinea pig. I don't have any diabetes, and I'm wearing this probe just to see whether I'm happy with the performance and everything, so that I can advise my patients. Particularly if you're needle phobic, you don't want to prick your finger like this, although to be honest it's a very little pain, almost no pain. But why should I still do it? I mean, I can easily scan. So the patients who are diabetic at the same time suffer from fatty liver or NASH, and as part of treatment they're trying to lose weight. Sometimes they are worried because you will definitely require less of anti-diabetic medicine when you are losing fat. Because your insulin resistance is coming down, and quite frequently the patient will have hypos if they're not careful, and if their diabetic doctor is not reducing their insulin or metformin dose. So with the security, with the safety and insurance of this kind of measuring device, you can have a graph, and you can scan as many times as you want to, and you know exactly what is happening to your, and scan again as many times. We need to dispose the needle in the shops. This is your needle bit, taking it off like that. Finger is still bleeding, but as you can see the bleeding has stopped. I'm just going to wash. Okay, so that's shops. Be careful that you don't touch it, and drop it, and drop that bit. And I'm dropping the blood stained ketone sticks as well, and that's it, done.